Well, the federal government faced more pressure in the House today from the NDP to commit to a universal pharmacare system. That was the key recommendation made in the final report from the expert panel appointed by the government. So how committed is the federal government to a national pharmacare plan? Let's find out. Ginette Petitpas is Canada's Minister of Health, and she's with me now. Good to see you again.
Thank you.
Thanks for being here. It's been 24 hours now. I know you had some initial comments when the expert panel provided its final report yesterday and this recommendation of a universal pharmacare plan. Here we are 24 hours later. Does the government accept what they're recommending?
Well, I have to say, first of all, I want to take this opportunity to thank the Advisory Council and for all of the work they've done. They provided us with an interim report in March with two key recommendations, two of which were, number one, to create a drug agency, which would be a foundational piece for a national pharmacare program, and also to make a significant investment when it comes to rare diseases. Yesterday, we received their final report, and I'm very pleased to be receiving it. Looking forward to reading it in its entirety, but I have to say that our government is absolutely committed to making sure that all Canadians have access to a universal pharmacare program.
Okay, so does that mean you endorse the recommendation as they've presented it? Universal, single-payer, publicly funded?
Yeah. First of all, I haven't had a chance to review the entire report. I've started reading it last night, and I'm looking forward to getting through the entire report. But we are committed to making sure that all Canadians have access to prescription medications. At this point in time, I can tell you...
But that's not the same thing as a universal plan, is it?
Absolutely.
That could mean just providing coverage now. Access to could mean providing coverage for the people who are caught in the gaps here. The 20% of people who may not have coverage.
We are absolutely committed to making sure that all Canadians have access to a universal pharmacare program. To make that happen, what we first of all have to do is to start negotiations with provinces and territories. As I've indicated just earlier on, the foundational piece of a national pharmacare program, though, we have to start with a drug agency. And we are serious and committed, and that's why when I say that we've started to do this tough work, because we've received the investments that we want to make sure that we get that agency right. And then from there, what we need to do is to start working with the provinces. If we look at the Medicare system back 50 years ago, that was a long time ago, and it wasn't done overnight. The federal government had to negotiate with provinces and territories, and there was a few provinces that started coming on, but it took about 10 years before all provinces, agreed to Medicare. And the same process is going to apply here. So as such, we are committed to working with all of the levels of government and also Indigenous communities, the healthcare sector, and the list goes on.
Okay, so are you satisfied with the model they're proposing? I mean, it's a fairly detailed proposal here that tells you exactly the route you should be following. Are you satisfied with their proposal that it should be, federal $15 billion a year by 2027 to fund this? It'll be some savings, I think, of $5 billion a year when it's finally up. But that you should take the lead, that you should fund the incremental costs. That all makes sense to you?
I'll be very frank, the federal government has to take the lead, because if we don't take the lead, no one else is going to do so. And do we know that there's going to be a cost incurred here? Absolutely. We certainly don't expect provinces and territories to sign on to a national pharmacare program and that the federal government is not going to be putting money on the table. So we are serious about wanting to get this done. We want to make sure that all Canadians have access to affordable medications. We live in Canada, and that should be a right for everyone.
What do you see as the role of the provinces then? Is there a financial component for the provinces here in terms of making this happen? Because that didn't seem to be the case in the proposal from the expert panel.
Well, we have to keep in mind that we can't impose this on provinces and territories, so we have to make sure that we're at the table together. Constitutionally, we're just not allowed to tell the provinces, you must do this. So as a result, we want to make sure that we're there. We want to make sure that we get it right. The other thing as well that we have to take a few steps back, when I talk about the Canadian Drug Agency, that agency plays a key role in making decisions like what is going to be included in the formulary, who's going to maintain that formulary, and the Canadian Drug Agency will be able to do that. But that work also, we're going to have to look at what are the needs of all the provinces and territories, because we want to make sure that Canadians aren't going to be receiving less coverage. If anything, we want them to have more coverage.
What more can you tell me about that? That's one of the concerns that's been raised, that we could end up with a formulary in a public universal pharmacare plan that has less coverage for some people that have workplace plans now. Is that a real possibility and a real concern?
Yeah. Well, we want to make sure that, as I've indicated, that Canadians aren't going to have less coverage. We want to make sure that they're going to have the same or enhanced coverage. When we look at the area of rare diseases, for example, we know that the cost that families incur is astronomical. And that's why that in Budget 2019, we've put aside $1 billion in order to look at that and to develop a strategy to effectively deal with this.
What more do you need to look at? I mean, in terms of if you say, yes, we're committed to a universal, we're basically committed to implementing in some way the recommendation of the expert panel. What are the
next steps?
Yeah, well, when you say that we want to make sure we get it right, what else do you need to look at? They seem to, Dr. Hoskins seems to suggest, like, all the studies have been done. This is the way to go. There's nothing left to look at.
Well, first and foremost, the Advisory Council have done their study, and we're very pleased with it. The HESA committee, the Health Committee, did their study, and it's very complimentary as well. I think we have to keep in mind a few things that we have to do going forward. Number one is to continue to do all that we can to lower the cost of drugs in Canada, and we've been working at that for the past few years now. The other thing as well that we need to do is to develop a framework in order to work with the provinces and territories in order to see where they're at, because we want to engage the provinces in these negotiations as we move forward. Is this going to be done overnight? No. When I hear the other parties say that by 2020 they would get this in place, I know that they have no plan. We've been working at this for the past few years now, and we know that for the rollout, we're going to have a detailed framework, and we're going to have to be committed to working with provinces and territories, and also making sure that we have money on the table, but as well the provinces as well. So we're going to have to be working together to get this done.
So what will be it's now we're about to have an election campaign, as you know. The NDP is clear. The NDP says and you question the timing, but they're saying, look, well, we don't need any more conversation around this. We'll promise a pharmacare, a universal pharmacare plan. The Conservatives seem to be suggesting that filling the gaps is the way to go, that let's provide coverage for those Canadians who don't already have it. What's the offer going to be from the Liberals?
Well, what I've indicated is that for the past 2 years, we've been working towards a path forward for a national pharmacare program. When I hear a party say they can get this done by 2020 without a plan, I think that Canadians can read between the line. They don't have a plan. That's not going to be the end product there. For us, we'll continue to work at lowering the cost of drugs, putting in place our Canadian Drug Agency, and from there, starting the negotiations with provinces and territories. We are committed to making sure that all Canadians have access to a national pharmacare program, and we're going to be doing the work to get that done.
Do you think that, let's talk the timeline then to finish, do you think that the timeline from the expert panel is then a reasonable timeline, that we should have a fully operational a universal pharmacare plan in this country by 2027? That's realistic.
Yeah, when I know that the Advisory Council, the work that they've done has been very thoughtful, and it's certainly, I think, a good estimate. Is it going to be exactly that? I mean, it could be earlier, it could be a year after. I'm not sure about that. But moving forward, we really are going to have to focus on putting together a framework, and we certainly want to follow the recommendations and move forward towards meeting those goals.
All right, Health Minister Ginette Petitpas-Taylor, good to see you. Thanks for
coming.
Thank you so much.